Hello and welcome again to the We Don't Have Time COP30 Climate Hub, coming to you live from Belém in Brazil at COP30. One of the most important and urgent considerations and connections in this climate story is your health, my health. Healthy children, healthy friends, healthy families, people you know, people you don't know, but it's all connected. While there have been signs of progress in other areas, one thing is painfully clear. The health impacts of climate change are worsening across almost every measure, and delays in action are literally costing lives. According to a new report from the Lancet and the charitable foundation Wellcome, millions of people lose their lives or livelihoods every year because of fossil fuel pollution and extreme heat and diseases made worse by a changing climate. But the report also offers ways out of this negative path. It shows that where countries and communities are cutting emissions and investing in resilience, people are already living healthier, safer, and more prosperous lives. Today, we're going to explore three of the most critical issues at the intersection: extreme heat, air pollution, and infectious disease. And hear from experts in international development leaders who are working to turn science into solutions. To start off on this critical conversation, please join me in welcoming Marina Romanello. She is Executive Director of the Lancet Countdown. Welcome, Marina. This report paints a very stark picture that the health impacts of climate change are worsening across most indicators. Can you walk us through what the data is telling us and where we stand right now on all this and what's changed in recent years?
Yeah, thank you so much, Nick, for having me here. And as you said, the latest report of the Lancet Countdown, which I should say is a huge effort from 128 leading researchers from around the world, from across disciplines, has perhaps the most concerning and sobering findings of the 9 years of reporting that we've had. We see that across 65% of the indicators, each of them tracking an aspect of the link between health and climate change and the risk of climate change to our health, 65% of those have reached a record new level of threats in the latest year of data. We had a similar finding the year before, which means that year after year, we keep on breaking records to people's on the threats to people's health, to people's lives. And we're seeing things like, for example, heat-related mortality growing. We estimate about 1 death happening per minute from heat exposure around the world. Over 500,000 people dying every year because of heat exposure. And we also see heat kind of affecting other aspects of our lives, like, for example, our sleep. We're seeing people losing sleep hours, which we know is essential for physical and mental health. We're seeing people's jobs being affected. We're seeing over 600 billion labor hours being lost globally because heat reduces people's capacity to work physically and mentally. And what that means is that some workers are being unable to be productive and to work in this heat. And why that matters for health is that is people's incomes, that is people's livelihoods, and that's the economy on which we know that oftentimes our health also depends on. So the impacts that we're seeing are quite multidimensional, are quite pervasive, and they're affecting, as they usually do, the most vulnerable members of our societies.
I was going to say, these are really important jobs that you're talking about, right? And these are people in agriculture. They're people repairing leaks, I don't know, from water systems. I mean, God names it. It's so many different jobs, right?
Yeah, and what we find, for example, just to give you another statistic that is quite shocking, when we look at the countries that are least developed, the ones that have low human development index, the vast majority of those losses, 75% of the losses in labor hours, happen in the agricultural sector. Agricultural workers, particularly in under-resourced settings, have very little means to protect from the heat. They have to work their land, and that often determines their access to food and the local community's access to food. So what that means is if it's too hot, either they're putting their life at risk by working in extraneous conditions, in extreme heat, or they're not being able to work as effectively. And what that means is that they're not producing the food that our societies need, and that has huge impacts also to local food security.
Really good points. I mean, many people are going to find these headlines quite shocking. And of course, actually, we want some of the leaders here and some of the governments to find it a bit shocking and do something about it, right? I mean, the millions are dying, every year from climate impacts. What does that mean in real terms? I mean, just expand a little bit on this.
Yeah, well, that means that people around the world are being exposed to these hazards that are exacerbating, for example, their underlying health conditions. So what will happen is, in a heat wave, we're going to have a relative that has a heart condition, that has a kidney condition or another chronic illness that gets very unwell that day, that gets taken to hospital and might not live after that. And that death might not have occurred if it were not for the very high temperatures. So people around the world, it might be hard to identify sometimes these links, but the data shows it very, very clearly how climate change is costing lives, is claiming the lives of our loved ones. And our health systems are at the receiving end of that. So we've seen around the world health systems overwhelmed. Oftentimes you have an extreme weather event in which people need access to healthcare, and during that same time, that health system is being affected by the impact of the extreme weather event. It has a power cut. The roads might not be accessible, so we cannot even access our health systems when we need them the most. So adapting to climate change is critically important. Our data shows us how delayed we are in adaptation. But there's another thing that is really important to take into account. If we don't reduce our greenhouse gas emissions, adaptation will soon become impossible to be done effectively. So we will not be able to protect our populations, even with our best efforts to adapt, if we keep on emitting our greenhouse gas emissions and the climate keeps on changing at the pace that it has, because it's simply too expensive, it's simply too difficult, and we don't have the resources. So it's important that decision makers here understand that we're negotiating with people's lives, that everything that happens in these negotiating rooms will determine the health of our children in the future, the type of health systems that we will have access to, and whether or not we can live thriving lives, healthy lives with healthy economies in the future as well.
It's kind of a moving target, isn't it? Because we don't actually reduce those emissions.
It's a moving target because it's going to get worse if we don't actually, reduce those emissions. These numbers are probably just going to climb and climb and climb. Yeah.
That's it. And the costs also, there's a lot of conversation now going about climate finance. We're already underfinancing health adaptation.
Yeah.
It's very underfinanced. That the budget of adaptation will only grow with each moment of inaction on mitigation.
Yeah. But the report also highlights that where action is being taken, the benefits can be immediate. Yeah. Cleaner air, fewer deaths, stronger communities. From your perspective, what are the most powerful examples of climate action already improving health outcomes today? And what should that tell policymakers and development organizations here in Belém at COP30?
Well, look, we have a lot of examples of what we call the co-benefits, the health co-benefits of climate action. What that means is we can tackle climate change, we can reduce our emissions, and by doing so, we can deliver transformative health benefits. So I'm going to give you some examples of what that potential looks like. Today, from the burning of fossil fuels, we're losing 2.5 million lives every year from the air pollution that they generate. The lack of access to clean, renewable energy means that people still use dirty fuels in their home, and that toxic air that they generate is claiming 2.3 million lives from poor indoor air quality every year. Those are avoidable deaths. And perhaps what is most hopeful is that we've seen that since 2010, we have not made much progress, or not nearly as much as we need, in terms of phasing out fossil fuels, but there has been efforts to phase down coal burning. And by doing so, this happened particularly in high-income countries that are having good access to clean renewable energies, a bit of an inequity there in terms of access to clean energy. But in those countries that have reduced their coal burning, we're already seeing the benefits in terms of cleaner air. And globally, we estimate that we're saving 160,000 lives every year from improved air quality that directly comes from the efforts that we've done to phase out coal, the efforts that we've done to clean our air and to tackle climate change. So even with the little progress we've made, 160,000 lives are being saved every year. That could grow very, very rapidly if we were to actually take action.
That's very interesting indeed. And I suppose in some cities as well, we'll get some numbers on maybe what electric cars are doing in terms of cleaning up the air as well. So that's a really interesting figure, Look, thank you so much, Marina, for setting us up for this absolutely critical discussion. We're going to bring on some more experts and dive deeper. Please stay with us. So, hello again. If you're just joining us, we're discussing the effects of climate on health and summarizing an incredibly important new report by Lancet and the Wellcome Trust. Now, diving into one of the gravest detriments to human well-being all around the world, and that's air pollution. I want to come to Zin Osho, Director of the Video Program of the Institute for Governance and Sustainable Development. Hi, nice to see you. I think we met before, I think virtually. Yeah, so air pollution has been in the headlines in India many times in recent years. What is the situation there now? And is there any sort of things may be improving?
Thank you so much for having me here, Nick. The situation is extremely grave. It's bad. We have about 255 cities, 290 cities in India that have crossed the 2.5 limit by the World Health Organization. Monuments are disappearing from Delhi's land and skylines. We are now looking at air pollution becoming a systemic crisis rather seasonal occurrence in India, unfortunately, to a point where doctors are prescribing, advising citizens and residents of Delhi to leave the city about 3 to 4 weeks in this season so that they can save up on about 5 to 10 years of lives. The situation is extremely bad. And this is evidenced by the fact that you are now looking at the National Clean Program, which is the government of your policy on clean air. The funds under which are underutilized. So last year we had 68% of the 1.3 million that was dispersed only be used. And also of the 60% was being used, 67% of that was being used on road transport, which is essentially dust. And what the government has done, unfortunately, is to focus more on PM10. instead of focusing on PM 2.5, and PM 2.5 is the more dangerous one, it is the carcinogen, it is the one that causes public health emergencies. And what the government, obviously the government also responding to it because it's the seat of power in India, it is where the Supreme Court is, it is where the legislators are. What government of India has done is put in place Delhi something called GRAP, which is the Great Response Action Plan. And there are 4 stages. We are in stage 3. One would imagine one should be in stage 4, but here we are. And the other thing, the more ridiculous thing that the government has tried to do is to seed clouds. It was an experiment that was being conducted by IIT with the government of Delhi, which happened about 3 weeks from now. And of course, it failed. And the reason for that is it never gained. And also, government really needs to look at data. Unfortunately, Delhi's air pollution comes from transport sector.
What would you most like to see from the leaders gathered here to make clean air part of the climate solution?
I think airshed. Air does not boundaries. It does not know state boundaries, it does not know regional boundaries, it does not know international boundaries. So a lot of the air pollution that we see in Delhi, of course, comes from the transport sector. That's the source of pollution. But you also have agricultural waste burning in neighboring state Delhi, in the states of Punjab and Haryana. So you're looking at a situation which needs multiple governments, both at international, national and subnational levels, to react and to take action. So having an airshed or real agreements on airsheds is the way forward between governments, between different countries and within national boundaries. That's the first. The second would be to recognize how climate finance also has impacts on co-benefits of mitigating short climate pollutants, black carbon, methane. How do you put dollar value on health? You know, here in Belém, we've seen as of yesterday a big health announcement. So how you integrate climate finance incentive to attach to core benefits like health and just generally the value of the environment, that would be the 2 takeaways for me: climate finance and airsheds.
Good. Well, thank you for giving us an insight into what's happening in your country and also countries around it because of climate change, or the things that cause climate change are also causing bad health, right? That's the point, isn't it? I think you have to go. We're going to say au revoir, goodbye, and hope to see you again sometime.
Thank you so much.
So thanks for being with us. Best of luck with your next event. Yeah. Let's come to you, Jane. Jane Burston, CEO of the Clean Air Fund. Jane, air pollution is often described as the world's biggest environmental health threat. Can you give us a sense of the scale of the problem and how it's linked to climate change?
Yeah, absolutely. So you're right. Unfortunately, air pollution overtook tobacco as the leading external threat to health last year. And it's causing about 8 million deaths every single year, which is a huge fraction of the deaths globally. It also affects people's quality of life when they're suffering from the diseases that are either caused by or exacerbated by air pollution. I think some of the ones that we think about the most when we're thinking it, because we're breathing it in, are the respiratory conditions. So asthma, lung cancer, COPD, but it affects every single organ of our body. So it can give us heart disease, cause strokes. And we've seen a lot of evidence, especially recently, about links between air pollution and dementia, Parkinson's disease, and Alzheimer's, because it's getting into our brains. Something that many people don't know about it is that it really affects children quite badly. Unfortunately, 1 child dies every minute because of air pollution, and it's because they're both more exposed and more vulnerable. They're more exposed because if you think about it, pollution, because it's some of it is particles, there are more of them closer to the ground because they're heavy. And children are small, so they're breathing it in. It's also close to the sources like exhaust pipes or resuspended road dust. And they're more physiologically vulnerable because they breathe faster than adults. So they're just taking on more per kilo of body weight than the average adult, and their organs are growing, so they're more affected. You mentioned the link with climate change actually in your introduction, and it's because a lot of the two real links. One, a lot of the time air pollution is emitted at the same time as greenhouse gases from the same sources, the main one being burning fossil fuels. If they emitted together, then they can also be solved together. So that's the good news. We can fix our climate at the same time as fixing our health by prioritizing things where we can address air pollution and greenhouse gases. The second link is that some air pollutants that harm our health are also directly bad for the climate. Super pollutants like black carbon or soot and tropospheric ozone. Tropospheric ozone isn't something that most of us have heard about, but it is a greenhouse gas. It's just not covered by the Kyoto Protocol.
Low level ozone, smog. Some people call it smog, right?
Exactly. And that's really bad for respiratory systems. Black carbon or soot is a component of particulate matter, the PM 2.5 we were talking about before, and that's getting into our lungs. Both of those two things are very warming for the climate. The good news as well with those two is that they're short-lived in the atmosphere. Black carbon in particular only stays in the air for about 2 weeks. It can get blown away, it can get rained out of the air. So the minute you stop emitting it, the minute it's not there anymore, and our health begins to improve as a consequence.
And the climate improves as well.
Exactly.
How can it be, Jane, that some of the things that you're describing, some of it is new science, the stuff on dementia and stuff, but a lot of the stuff is been around as good science for a long time, especially thinking about children and being close to the tailpipe. Why are the governments not taking this seriously?
Well, it's the same as the systemic problems leading to climate change, right? It's vested interest and all of our reliance fossils.
Eamon Ryan, high-level climate clean air coalition, proudly held by the Environment Programme.
Maybe the most frustrating thing for me in recent weeks, Bill Gates, in this kind of trade between climate health, it's true. That's the case, because one of these solutions is good for health. It's not just that we won't have any health if we let the climate go. It's that the actual solutions to climate address health. That was an incredible mistake in my mind and him in the public discourse. We need to counter that and really get back to the simple, clear truth that the climate solutions are going to be better economically, better for our health, better for development, as well as for climate.
Good. Well, Mike, going to have to wrap up in 2 seconds, but Jane, you just want to say something quick?
I just had an example of exactly what Eamon is saying, which is what's happening in Poland at the moment. A lot of the heat in Poland is from burning coal domestically, and in many places they put a ban on that because of the health impacts. We've seen coal burning come down by 1.5 million households. That's reduced deaths by 20%. So 10,000 fewer deaths a year from those 1.5 million households that have already implemented heat pumps and other heating solutions. So we can see it's working in the countries that are doing it and providing economic prosperity at the same time, like you say.
So the tripling of renewable energy and the doubling of improvements in energy efficiency worldwide is actually a health policy, and everyone needs to fulfill that promise that they made in Dubai in 2 years ago.
Exactly.
Good. Thank you very much for speaking to We Don't Have Time. We're going to take a short break, and when we come back, we'll be talking about yet another critical health consideration in the climate space, and that's extreme heat. Hello, if you're just joining us, we've been talking to some of the well-renowned experts about the impacts of climate on human health, a topic we've recently learned a great deal about in a new report by the Lancet and Wellcome. Right now, we're diving deeper into one of the other major issues relating to climate and health, and that's extreme heat. Here to help us understand more, we have Estelle Willie, Director of Health Policy at the Rockefeller Foundation. Alexandra Matsar, yes, hello, Senior Policy and Advocacy Advisor, United for Global Mental Health. And Michelle Isles, I say Isles, yeah? CEO of the Climate and Health Alliance. Great to have all three of you with us, that's super. Let me come to Alexandra first. Normally it's women first, isn't it? We've got something wrong here in the script. Anyway, we'll press on. Alexandra, we often talk about heat's physical dangers, but what do we know about its effects on mental health and well-being first?
Thank you so much for the question and for giving me the chance to address this often underappreciated topic. Well, heat impacts every organ of our human body, from our heart to our kidneys. And so it also impacts our brain and therefore our mental health and our brain health. And given that we don't have time to go through all the different impacts, I'm just going to focus on two key outcomes of interest. One is suicide. So we tend to see increase in suicide rates and suicidal behaviors during extreme temperature events. So to give you an example, data from the Office for National Statistics showed that only in England and Wales, we saw an increase of 650 deaths attributable to extreme temperatures. And it's important to highlight how each of these deaths are somebody's family, somebody's person from their community, and so that very deep impact that they can have on people and on the community that surrounds them. The other is the impact that heat can have on people with pre-existing mental health conditions. So we know that living with certain mental health conditions can put you at a much higher risk of experiencing poor physical health outcomes in the context of heat. So higher mortality rates, higher hospitalizations, higher rates of certain illnesses. So to give you an example, in the 2021 dome phenomenon in British Columbia, we saw that people living with schizophrenia had the single highest risk factor for dying in that context, and living with schizophrenia tripled the risk of death compared to people without that condition. And I can tell you a lived experience story from Phoenix, Arizona, where a 33-year-old man living with schizophrenia in the midst of a episode of psychosis wandered out of his house and in a state of confusion died in an abandoned parking lot because of the fact that he didn't know where to go, and that resulted in the death. So we can see many different types of impacts on mental health.
These are very tragic stories indeed, and very moving. How do we keep safe when we have rising temperatures?
Okay. I think that's great, and there are solutions. On the one hand, mental health does tend to be included, comes to heat health and policies. So we recently worked on a review that explored how mental health features into heat health action policies around the world, and found that the majority of heat health action policies do include mental health. However, very few include concrete actions on what people and communities can do. But solutions do exist, and I just want to highlight a couple of examples. One is the heat early warning system from South Australia, which I think is a good example, where people living with mental health conditions receive a daily telephone check-in to just check they're doing okay in the context of extreme weathers. And if they don't reply, they receive a house visit. And this has shown to reduce mortality, reduce morbidity, and to be cost-effective in the long term by reducing illness and mortality in people living with these issues. The other final example I wanted to mention is that we're seeing mental health professionals, psychologists being more and more involved in response to extreme heat. For example, in Athens, counselors are sent to houses of elderly people to ensure that they're not experiencing too much loneliness. We're seeing in data, psychological counselors are being activated in call centers, how the mental health professional can play a role in protecting the mental health of people in the context of extreme heat. So yeah, solutions exist, they work.
Good.
We need to get them.
I'm pleased about that. Let's come to Estelle. You're the Director of Health Policy at the Rockefeller Foundation. Money is a key for financing adaptations. Tell us the role of philanthropy to make things happen and to safeguard people's health in this area.
It's not philanthropy as usual anymore. We can't just keep resuscitating a dying model of development when we see the norm systems and institutions developed in the 20th century post-World War II failing time and time again for both the people and the planet. So what can we do? Philanthropy can take the biggest risks to test out solutions on the ground to see what works, what doesn't work, what should be scaled through domestic resource mobilization, through the banks and MDBs, through donor funding, whatnot. But first we have to understand, is it working? And so we need to go out there and understand, take the science from the Lancet Countdown and apply it in the messiness of this world. I'll give you an example. In Rio, at a Taylor Swift concert of all things, during a huge heat wave, unfortunately, a fan died. And in this devastation, the Rio mayor, who just won the Earthshot Prize for implementing this, brought together all of the sectors to come together to solve this problem. Because heat isn't owned by any sector, but it impacts not just our health. The ripple effects go into productivity loss, income loss, GDP decline, forced migration. I mean, there's a whole ripple effect that's insidious because of the impacts of extreme heat. So brought together all these different sectors and mandated that they work together and develop a heat action protocol, as you described earlier. And what they did was during Carnival the next year, they activated the heat action protocol. And this takes coordination. I mean, there are hundreds of thousands of people on the streets of Carnival enjoying themselves. How do you activate and bring cooling stations to people? How do you deliver water? I mean, these are really simple things. As people just say, these are like innovations that already exist. But the coordination and the working together is how they were able to protect people and allow them to thrive and have a good time during a heat wave. And because we see this working and the impact of this working in Rio, we're now working with C40 cities to take what we're learning and scale it to other cities that have very similar situations through the Cool City Accelerator. And that's how we are able to test and scale and bring in new partners.
So I love the idea of a cool city accelerator. Yeah, I mean, and you just touched on a couple of things. I mean, nature-based solutions are very important too. More trees is good. They're not only cool the city, but they also filter out particles as well and other rubbish in the air. I mean, we're running out of time. There's a little clock there. Can you see? It says plus 16 seconds, which means we're actually over the time. So I was going to ask how much more money is needed for all this, but we could go on and on with this topic. I think we have to shut it down, but we all may be coming to Australia next year. So we can see some of these things happening in real time, you know?
Well, come to Darwin.
one of the hottest cities in Australia,
Yeah.
where the hospital, outside the hospital, was getting up to 50 degrees Celsius. So big Indigenous population. All the families come to see community in hospital were experiencing heat stress and then heat-related death. So what a leading physician, I'll call out Dr. Mark D'Souza, created an extensive garden and green template for hospitals that can be replicated across Australia, and it's cut temperatures by 15 degrees and it's created a safe environment for people to come to experience.
We have to keep recreating the world, do we? I mean, the fact is, there's so many solutions out there. We just need to bring them together and apply them, and that makes sense. We've got to end here. Thank you so much for sharing your expertise and your info. There's a lot more to talk about, but the TV show, so we have to move on, and we're called We Don't Have Time, so sorry about that. Stay with us and watch the rest of the show, please. So we're back again. In case you're joining us now, we're in the midst of a segment discussing the impacts of climate change, health, spurred by a crucial new report from the Lancet and Wellcome, with some very important points on extreme heat and air pollution. And we're now turning to infectious disease, yet another way in which climate change is making health challenges more severe. Briefly, on financial services, Joan, maybe I can sound a bit clearer. What kind of investments do they need to make going forward to deal with the issue of infectious diseases, if I can put it away?
So, a number of things. I mean, in the financial service, what are actually recognizing the increasing spread of infectious diseases, and also recognizing that no one is safe until everybody is safe. It's something that came through from the pandemic, that sense that if an infectious disease is somewhere else in the world, it doesn't stop there. The world is a hub and it's spread. So the financial services are recognizing they must understand the risks, or the risk of not intervening, and actually take action. Actions they can take are, firstly, actually supporting a health workforce, really looking at supporting the innovations and technologies, particularly the vaccine technologies. How can financial services move forward with vaccines, supporting them, putting their funding behind that in order that we can see those changes, and particularly for the neglected diseases, those diseases that those that are impacting people in countries, particularly in African countries, that we're not really listening to. Schistosomiasis diseases we're not seeing in high-income countries, but they are really impacting others, and it's thinking about how do we respond globally and ethically and equitably to these.
Okay. Let's come back to you, Johan. So, what are driving the shifts? I think that's the big thing really here. It's in part, I would imagine, climate change. It's in part that we're changing the stability and the resilience of the planet, which is also adding to climate change, but in ways that we never thought about even, 100 years ago. Yeah.
Oh, absolutely. I think the example of Nipah that you quoted just now it explains very well the chain reaction that we're seeing. And another thing is because the environment is getting warmer, it's getting there's more rain, more floods. It is getting much better for mosquitoes and other vectors to thrive. And this has of course driven up vector-borne diseases, but also waterborne diseases. That's one aspect. And then there is the indirect impact, because droughts and floods are driving people out from their homeland. So there is a lot of migration going on. People are moving to a new part of the world where they are not familiar with the diseases that are circulating around there. And then there is another aspect that because there is infrastructural disparities in the global south. So the global south is actually the hardest hit because their health systems are just not as well equipped to deal with all these outbreaks, or even in terms of primary healthcare, it's just not as robust. So these are some of the worrying trends that we're seeing right now, and we still need more actions to be done.
We're fast running out of time, but what do you feel, briefly, both of you, internationally? I mean, what can a COP30 do? Or is it in the end we have to stop climate change? Yeah, maybe briefly, what do you think?
Well, I think to me, the most important is political commitment. And we are seeing something very good here that happened just yesterday, the Belen Health Action Plan. I saw a few other panelists mentioning that as well. This is actually a very commendable effort by the Brazilian government, trying to make sure countries work together, get something done, and they're very action focused. And more importantly, it is equity focused. So making sure that the most vulnerable population will get will be one of those who benefits from these actions. And then with political commitment, we are hoping that there will be more financial commitments. We hope that here in CEPI we always say climate resilience is pandemic resilience. They go together, and we just need to make sure that countries make smarter investments that can benefit both climate change and also fight infectious diseases, both in one go.
Okay, and Liz?
Indeed, just echoing what you say around the Belém Health Action Plan, because it's an actionable plan. That's what's so fantastic about it. It makes, we're being given incentives and ways of working together. I think what COP30 can do is picking up work that Wellcome have been saying for so long, understanding that health and health assets are the greatest assets that we have. And therefore, when we invest in health, we invest in economy. The other big piece of this, and I think it was touched on yesterday in the program launching, is that the philanthropy sector, the financial industry sector, the business sector must come together to strengthen the response forward. It's not siloed. It's not health and climate and finance and energy. It's one thing, it's interdependent, and that's the message that came through.
Exactly. So climate action is epidemic prevention. That's one of the messages we need to take home immediately. Well, we don't need to take home because we know now, but the leaders need to do that here. Thank you again, both of you, for being with us. Jörg Hang and Liz Grant, educating us or giving us a glimpse into this really fascinating topic. We're going to take a short break right now, and when we come back, we'll be talking briefly to Alan Dangor, who's Director of Climate and Health at the Wellcome Trust. So, thank you. Great. So we're just wrapping up what has been a fascinating, but also a quite a moving session, I would say, inspired by the 2025 global report of the Lancet Countdown, a hugely influential and important report put together by the internationally respected Lancet Medical Journal and the global charitable organization Wellcome, or the Wellcome Trust. Either way, I think works. To finish up, we're speaking with Alan Dangour, Director of Climate and Health at Wellcome. Alan, throughout today's discussion, we've heard how climate action can be also health action. I think that's a key message. What are the smartest investments the world could make right now to save lives and build those healthier societies?
So it's very clear that the impact of climate change on health is enormous. And you've heard that about heat, infectious diseases, and that's now abundantly clear. So we must act. And obviously, the most important solution is to reduce greenhouse gas emissions, and that would have an immediate impact. You heard about air quality and the impact of air pollution on mortality. That would have an immediate impact both on reducing, slowing down climate change, but also on improving health. But then we must recognize that mitigation is essential, but we must adapt because the impacts of climate change are here now. So those solutions that help populations and communities adapt to climate change are critical. And some of them are incredibly simple. Cooling breaks, planting trees in farmland to give farmers shade, access to water, access to cool rooms, those sorts of things. Very, very simple. And we know now from very high quality scientific evidence that those work. They reduce temperatures, they reduce core body temperature, they reduce heart rate. They're really simple, but also slightly more technical things like early warning systems for heat waves, or early warning systems for infectious disease outbreaks caused by climate. These are the things now that everybody needs to have. Every city needs to have, every hospital needs to have, every school needs to have, so that we can protect individuals, communities, and countries from the impacts of climate change.
There's also a biodiversity angle. Sorry, there's also a biodiversity angle here as well, isn't there? Because some of it is the way our landscapes are being changed by maybe more intensive agriculture, which is leading to less resilience and diseases spreading this way.
Absolutely. And that's very clear. And we also, there are many nature-based solutions. I mean, I mentioned trees. It's a classic example of a nature-based solution, but also mangroves. And also, there are many greening cities to cool the city. So yes, of course, trees will sequester carbon, and that's what we need to do. But also, they will cool the city notably. Yeah. They provide an ecosystem service, as exactly as you say. And the more we go into that land, the more we come into contact with nature, and that increases infectious disease risk. So there are many intersections with nature that need to be thought about, and many of the solutions, of course, come from nature.
From your perspective, what message from this new Lancet Wellcome report do you most want the policymakers here at COP30 to take to heart? And not just COP30, I think for all the COPs to come and all the other big international meetings that go on around the world. Yeah.
Well, I think the key thing is that we, up until now, we've thought very much of climate as climate and health as health. And the Lancet Countdown report makes it abundantly clear that climate health intersection is real, it's massive. So the impacts of climate change on human health are enormous. We must mitigate, we must reduce greenhouse gas emissions immediately, because it will protect our health, but we must also simultaneously adapt.
What is the human face of climate change? Health is where we experience climate change ourselves, our families, our communities. So it brings it home. But we also know, I mean, you ask about businesses and governments, we also know that a sick society is not economically productive, can't grow, can't develop. And therefore, we are heading towards a world where the impacts of climate is going to be so great that economies are going to falter.
Indeed. So, Alan, when it comes to a turning point, do you think COP30 might be a turning point in this intersection? Well, would you really understand the connection between health and climate change?
Well, the first time health was really prominent at a COP was in COP28, where there was a thematic day for the first time on health. And that was a really exciting moment. This year at COP30, we actually have a plan. The COP presidency and the Brazilian government have put forward the Belém Health Action Plan, which really elevates the need for surveillance and monitoring, the need for evidence-based research, the need for innovation in the intersection of climate and health, and a very strong cross-cutting theme of equity, making sure that everyone benefits from climate action. So the argument has been very strongly made this year at COP, so it could be a turning point. But clearly we need to give the COP presidency and give governments an incentive. And yesterday, 35 philanthropies, global philanthropies from around the world came together to announce a $300 million pledge for the Climate and Health Funders Coalition, which is really going to try to tackle these, generate the evidence, build the momentum, and drive the advocacy on issues like extreme heat, infectious disease, air quality, and data for decision making.
This is really, really good news. Thank you for sharing this.